Today is Friday, the 16th of April, 2021. I'm here at the Ministry of Health, Minister Secretariat, to take my COVID-19 vaccine. It would be the Sputnik 5 vaccine. The last time I took a vaccine was in probably 10 years ago. It was a vaccine for yellow fever. I needed to travel at that time and I thought it was a necessity. It was a travel necessity at that time. I think taking this vaccine this time around is also a necessity as we try to fight this pandemic. Follow me in this journey as I take my vaccine. I will tell you about the process, how I felt after I took the vaccine, and we will also talk to a healthcare professional in this brief Prime Conversations.
Before we can proceed to vaccination, I have some questions to ask you.
Sure.
Are you sick today?
No, not.
Are you allergic to any medication, food, vaccine components, or latex?
No.
Have you ever had a serious reaction after receiving a vaccine?
No.
Have you recently been diagnosed with COVID-19?
No.
Do you have any cancer, leukemia, or any other immune system problems?
No.
In the past 3 months, have you taken medications that improve your immune system?
No.
Do you have any long-term health problems such as heart disease, lung disease, asthma, kidney disease, diabetes?
No.
During the past year, have you received a transfusion of blood or blood products?
No.
Are you pregnant, or is there a chance you could become pregnant during the next month?
No.
Have you received any vaccines in the past 4 weeks?
Not in the past 4 weeks.
Take this volunteers and the doctor will administer your vaccine.
Hi, good day. I'm Dr. Dev. I'll be giving you your vaccine today. The vaccine you're receiving is the Sputnik vaccine from Russia. The vaccine is 2 doses. You're getting your first dose today and your second dose will be in 28 days, which for you will be on the 14th of May.
Okay.
And that date is written on your card for you to remember, right?
Thank you.
Are you left-handed or right-handed?
I am right-handed.
Okay, so I'll be giving you your vaccine on your left shoulder, right?
Okay.
So you might take it back to me.
Sure.
Pull your left sleeve.
All the way up?
If you experience any of the usual expected side effects, which may include a mild fever or some pain to the vaccination site, you can take 2 Panadol every 8 hours. You could also apply some ice to the shoulder for 20 minutes every 4 hours. So after you receive this vaccine, you'll have to sit and wait with us for about 15 minutes for simple observation. In terms of restrictions, the only thing you're not allowed to do is drink alcohol for 24 hours.
Dr. Dev, what does this vaccine really prevent?
Okay, so the vaccine you just received, the Sputnik vaccine from Russia, it is 91% effective at preventing you from getting COVID. But it is 100% effective at preventing you from getting the severe form of the disease, right? So that's very important because, as we know, a lot of young people are getting the severe form of the disease and ending up on the ventilator and very seriously affected, right? And none of the vaccines are 100% effective at preventing you from getting the disease in the first place. It is still recommended that you take all of your precautions, wear your mask, practice social distancing, use your sanitizer, and all of the things that we've been trying to enforce the public to do during the entire pandemic, right? And just to remind you, so you've had your first dose, you require your second dose to be considered fully immunized, right? So as I mentioned, your second dose for the Sputnik vaccine would be in 28 days, and for you, that would be on the 14th of May.
And when I take the second dose, there's still not 100% coverage. I still have to take my precautions.
You still need to take all of your precautions, correct?
All right, thank you very much. I've had my vaccine. It has been reduced to a very small hole, a very small looking hole. This is my vaccination card. I have to return on the 14th of May for my second dose of vaccine. I did have to wait around for about 15 minutes to be observed after taking the vaccine. I felt fine. I didn't feel any particular symptom or any side effect. I had no lightheadedness or fever. I feel really good. I would really encourage everyone, if you have checked with your doctor, take your vaccine as early as possible. Thank you for joining us on this special edition of Prime Conversations.